So hey guys, today we will talk about what is the mucopolysaccharidosis. The first of all, you heard about like heteroglycans or like cake glucosaminoglycans, which is also called as a mucopolysaccharide. So after the utilization of this all molecule, and what is the heteroglycans versus homo glycans. In the homoglycans, the all the monosaccharide are same, and in the heteroglycans, all the monosaccharide are different to each other. So in the heteropolyglycans, also called as glucosaminoglycans or mucopolysaccharide, after the utilization of each all of them, the rest of we should be lysed by lysosomes. How lysosomes degrade these molecule. So lysosome have a H plus ATPase pump. By this, lysosome create a acidic environment within it and degrade all glucosaminoglycans or mucopolysaccharide. If anything which goes wrong with the lysosomes, the glucosaminoglycans or mucopolysaccharide which will not degraded, and it's accumulate in the lysosomes, and that is called as a lysosome storage disorder, or we can say mucopolysaccharidosis. So mucopolysaccharidosis it is a three, it is a many types, but we for our exam we will remember only the type 1, type 2 and type 3. So type 1 it's called as a Hurler disease. It is due to a deficiency of the alpha iduronase enzyme, and it is important to remember because they are asking in our exam. And second is a Hunter disease, which is due to a deficiency of the iduronate sulfatase. And the third one is the most common type, sulfonamide disease, which is due to deficiency of the heparin sulfaamidase. So the common rule you all should remember, that is any disease is caused by enzyme deficiency or defect, that disease will come in autosomal recessive category. So what is autosomal recessive category? In which the autosomal recessive. So let's some talk about also in what is the autosomal recessive. So autosomal recessive, like say capital A is normal allele and small a is abnormal allele. So mostly it is male and female are equally affected, but the patient has a disease if their allele in homozygous states only. Okay, so in our board exam they give you like this is the father and the mother, but the sibling, the offspring of these parents, it's defected means affected, and the offspring is having a disease, but the parents does not have a disease. So how how the how it occur means, if the both the parents have a recessive allele, then the offspring has how many percentage of the chance to get affected by the disease. So if the disease is also recessive in carrier status and the mother is also in a carrier status, so we see like this. So capital A, capital A, capital A, small a, capital A, small a, and small a, small a. So both are homozygous state, so it is completely abnormal and will have a disease. And these two capital A homozygous state, it's completely normal, and these two set capital A, small a, which are will be in a carrier. So there is a 25 percentage of maybe offspring normal, 25 percentage of risk of the abnormal, and 50 percentage will in carrier states. Okay, how you this remember? It's very important for our exam. So let's go back into mucopolysaccharidosis. So how to remember? So all the type 1, type 2, type 3 and further all are enzyme defect. So I said like if the enzyme defect, they all are come in the autosomal recessive category. So all are in autosomal recessive, but Hunter disease is not in autosomal recessive, it is X-linked recessive, and all others are have a cloudy cornea, but Hunter disease doesn't. So how you will remember? So you just remember like we have a dot like X, we have to make a focus on X. Normally hunters are hunting practice on these kinda boards. So this X for X-linked recessive, and if the person is hunter, that means hunter should not have a eye problem. If the person have a eye problem, then the person will not be a hunter. So this is the way. So hunter doesn't have or has eye defect, so no cloudy cornea. So we all over to summarize, we remember that the type 1 is a Hurler disease, which is due to deficiency of the alpha iduronidase. Type 2 is Hunter disease, it's iduronate sulfatase deficiency. There is no cloudy cornea, and Hunter disease is X-linked recessive. The type 3 is the most common one, Sanfilippo, and heparin sulfamidase deficiency. So what is the clinical features of the mucopolysaccharidosis child? The child have a faces like Gargo-like faces. So now you are see this is cloudiness in the cornea, except I said Hunter disease does not have a cloudy cornea and an X-linked recessive. There is a flat nasal bridge and copious nasal discharge and large tongue, macroglossia and thick lip. If we took the X-ray, we see there is a flattening appearance of the ribs. There is a bullet-shaped metacarpals, and the bickering means a narrowing of the vertebra at the corner. Narrowing of the vertebra at the corner, which is decrease the overall axial length of our spinal cord, and so that further we decrease our axial height. So short trunk, and that is come under the pathological short stature. So mostly the question will frame like this: the child has a cloudiness in the cornea, copious nasal discharge, macroglossia, and the clinician took is X-ray, X-ray of the chest X-ray CXR to rule out the pneumonia, but that is showing that flattening of the ribs. And further investigation stated the patient means a child having a mucopolysaccharidosis. Thank you.